We're honoured to have you, Silvia, on board as our course director in small animal internal medicine. Silvia is an internal medicine specialist based in San Francisco Bay, and it's a pleasure to have you here with us.
Hi, Emma. Thank you so much for the introduction. My name is Silvia Funes. I'm a doctor of veterinary medicine. I work in the San Francisco Bay Area as an internal medicine specialist, and I have the pleasure to be part of this new project. We are going to chat a little bit today about the new master and what our goals are for the students and give you more information so you can learn from us.
Silvia, take us back to the exact moment when you knew that veterinary medicine, and especially internal medicine, would become your life. What did you feel? Where did you see this decision taking you in your veterinary career?
So this goes back very, very far away. I was actually 14, 15 years old when I had my first dog. I wanted to have a dog for a very long time. My parents, I didn't came from an animal loving house. So my parents finally gave up and I got my first dog, but it was my dream dog, my golden retriever. It was the cutest puppy I ever seen in my life. So I brought it home by myself. And his name was Nico. He was super important in my life. He truly made me love animals. I actually finally understood what it was having a soul dog. And I think that connection helped me through the hardest teenage years and actually gave me the vocation to become a veterinarian. And to this day, still, when I'm on the clinics and I have a very hard day and I'm dealing with an owner who is extremely attached to their dog or has been a very difficult person, I still go back and that gives me empathy because more likely that person just feels about his dog the same that I felt about my first golden retriever.
So today you lead the small animal medicine postgraduate certificate program that breaks with classical structures. Why do you believe a program based on competencies and clinical syndromes is better than one organised by systems or organs? And how do you think veterinary surgeons are going to react to this change?
Yep. So that's a great question. So the problem is that we are in a world where right now we have lots of information. I can open like a Google search, I can open 1,000 books in one click and have lots of information about the topic. But the reality is that a dog doesn't come to the consult telling you, I have acute liver disease. It comes to your consult because it vomits, or it comes to your consult because it doesn't want to eat. So learning how to go from that clinical presentation to a definitive diagnosis is truly what happens in practice. And learning how to go from getting a good history from the owner, putting that history of the owner with your physical exam, kind of with your list of differentials, and then choosing the most appropriate diagnostics testing is something I feel is the way we need to pass along to students and the way we really want to train these students to think about veterinary medicine.
Okay.
I hope that answers.
And how do you think veterinary surgeons will react to this change?
I think it's going to be different as everything when you start a new program that explains things in a different way. I think it can feel a little shocking, but I also feel it's going to revolutionize the way we teach and it's going to end up having students who truly not only learn the content, but also know how to apply it to the real life. Like my hope is that the next time a dog comes to the office vomiting, they are able to come up with good history taking, asking the right questions, and then feel much more confident approaching the patient.
So if you compare this new approach to the training that you received, what elements do you think would have changed your own experience as a student?
Well, when I came out of the university, I actually moved to the States to do my internship and to work in different practices. And I think knowing that I could approach a patient from signalment to diagnosis, it would have been very helpful, especially more than anything when I was talking to the owners about which test I was recommended. So I think it's gonna my hope is that it helps and it fills that void that I have to go through after finishing vet school. It helps these students to be able to chat with their clients and provide best care.
Yeah. So this program includes active methodologies, simulations, interactive clinical cases, and personalized feedback. So tell us a little bit about these innovations and which of these tools excites you the most in terms of the impact it can have on real veterinary practice?
Okay. So with these activities, what we are trying is to go from passive learning to active learning. So first, we are going to do those short lectures where we get all the information. And then with these activities, what we are going to try is to get that information into what we would do in the clinical practice. And that is pretty much the goal of them, is to try to explain people how to apply that information. Again, we have information everywhere. We do choose to have speakers who work in the clinic, so they are able to also give us the information in a short version that is very clinically applicable. But the activities will help us to consolidate the full course, to go from this passive learning or being at home and studying to active learning or applying that knowledge to the cases that we will see in the clinic.
Finally, to wrap up, if you could leave a message for veterinarians who dream of making a difference in veterinary medicine, what would it be?
So this is something I actually tell my interns and the students I have. In the hard days, because we all have hard days, I see 20 cases every day, just take a second and remember why you became a veterinarian. Because you became a veterinarian for a reason. And more likely, the reason is either because you have a dog or a cat that you truly love, or you are just very passionate for the profession. Veterinary medicine is one of the most vocational careers in the world. So in those hard days, I think it's really it's very easy to feel like you are in a hole, and trying to close your eyes and turn back and look back and see what made you a veterinarian, I think it's very helpful. And I still do that pretty much once a week when I encounter a very difficult person or a very difficult case.
Brilliant. Thank you, Silvia. It's been lovely talking to you.
Well, thank you so much, Gemma, for this time. And I hope this is helpful. And if you have any questions, just please reach out to us. I hope to see you all in the postgrad course, and I will be there to guide you through the process.